Welcome back. Now, there's a broad understanding that an improved health sector can lead to sustainable economic growth in Nigeria, and this has made the calls for higher public revenue, which can translate to higher investment in health infrastructure, pertinent. Nigeria's health infrastructure, according to experts, has the potential to increase availability of food, increase earnings, which makes health spending more affordable and will aid in growing a healthy economy. Trained system engineer Oluwasoga is one of the outstanding entrepreneurs that represented 8 African countries in 2020 Jack Ma Foundation's Africa Business Heroes competition and made the top 10 finalists. He joins us now on the program. Good morning and thank you for coming on the program. What stood you out in the Jack Ma Foundation's Africa Business Heroes competition?
Thank you so much for having me. I think one of the things that they saw in our application was the traction we had. We, just as a primer, we build and operate diagnostic facilities across the country, particularly in places that need it the most. And so I think that they saw like the work we're doing, how we've executed when we started. And we also told a really great story about what we are trying to do. So we painted a really great story about the vision we're trying to achieve. So for us, what we want to do is actually build a lot of these centers so that diagnostic is like more readily available across the country and across the continent. And I think that they saw that story and then they believed that since we've been doing it, that we can achieve it. So, and I think that that's why we are where we are today. Thank you.
Now, a healthy nation, we know, is a wealthy nation. As a participant in the Jack Ma Foundation's Africa Business Heroes competition, are there lessons you must have learned as to how Nigeria can get its health sector working?
Yeah, what I would say throughout the competition, one of the things that we had to do is we had to be very adaptable to different things that were required of us. And similarly, I think in the health sector, given the different challenges we have, we always have to be adaptable to what we are to the condition. And I think that with this application, one of the things that we had to show was that we can execute and we can paint a really good picture of what we do. And I think that in the healthcare sector too, I think execution is key. It's not just enough to have these great ideas of what you want to do. You also have to implement those ideas and make sure that those ideas come into fruition. And I think that that's one key learnings that we've learned as part of this competition, and that we also applying readily in our day-to-day job at MDAS.
So how, you are more of a tech person in the health sector. How do you think technology can support the growth of Nigeria's health sector?
Yeah, I think technology has a huge role to play. And we already saw that during the pandemic, when it was peak pandemic period, the rise of telemedicine app, where people can easily get access to a doctor just from the comfort of their own homes, where they don't need to really go to like a brick and mortar facility to get care. We see that accelerating over as time goes on. And I think that technology has a key role to play to make that happen more broadly. But then I also think that the technology piece is not just limited to telemedicine. We have great insurtech companies that are making health insurance more readily available to the public. I think that that's great. We have remote diagnosis where a radiologist can sit in Lagos and diagnose from multiple locations. That's something we currently do within our center, in our company. And so overall, what I would say is that technology is really key. But I don't think we're there yet. I think there's still some key foundational pieces that needs to be in place for that adoption curve to be a lot smoother.
And let's also talk about telemedicine now, which is fast becoming an in thing now, especially with the COVID-19 pandemic. But is there any future for this kind of technology here in Nigeria?
Yes, absolutely. I think from now going forward, I think telemedicine will always be a part of health provisioning in Nigeria. I think a part where we really need to figure out is how do we make it more readily affordable for people, and how do patients get really comfortable with the idea of being able to like access a doctor remotely. And I think because of the pandemic, that gap has been bridged a lot. And so we see so many telemedicine apps right now. Even insurance companies, HMOs are actually onboarding people on these types of apps. We see that more readily available right now. And so we think that COVID has been an accelerator for these types of platforms. And in the future, going forward, I think it will just become part and parcel of care. That we won't think about telemedicine as something different from care provisioning, to just be a part of providing care to people.
Now, I'd like to hear your thoughts about affordable healthcare system and how Nigeria can actually achieve that.
Yeah, I think that's one of the biggest problems we have. I think there's two key components of that. That is, of course, on the reimbursement side. That right now most of the care provision in Nigeria is out of pocket, and that hits people hard because we're really a low-income country, and so I think that going forward, what we need to do is, of course, work on the supply side. Make sure that a lot more people are enrolled with HMOs. We want more state insurance schemes to cover a lot of people, so that people can readily access care without having to pay at the point of care. And we think that if that happens, then there will be enough funding available to invest in the infrastructure piece, which is another big problem in healthcare, is that we have a huge deficit of infrastructure. That's something we're personally trying to solve for. But until you fix that supply side of care, it's very, very difficult to fix the demand side. And we think that the key to providing this universal access to care is to government policy has to help roll up more and more people so that they're not paying out of pocket, because we are a really low income country. And so that's a critical piece of the equation.
Now, I'm glad you talked about funding on the part of government now, and that brings me to my next question, which is the fact that the COVID-19 pandemic has further exposed the challenges in the nation's health sector. What is your assessment of the government's response so far, especially in terms of funding?
I think that the COVID story has actually, given what we hear from other parts of the world right now, we have done actually a great job with it. I think a lot of, we need to, when we do a great job in our sector, healthcare sector, we have to be able to acknowledge that. And I think we've done a great job looking at how the positivity rate has dropped down. I think, of course, funding will always be a problem, but I think when we look at things overall, I think we have done a great job. And right now, it doesn't look like we see like a huge second wave as we're seeing in many parts of the globe. But even if that happens, we know that we have enough experience to know what to do, to know how to contact trace people, to know how to test people, and so on and so forth. And so even looking at how we've scaled up the number of molecular labs in the country, I think that that's actually one of the success stories of this year in the healthcare sector, is that we actually reacted, at least given our resources, given what we had. I think we had a great response to COVID-19.
CEO MDAS Global Oluwasoga Oni, thank you for joining us on the program, and here's wishing you all the best in the competition.
Thanks for having me.
Moving on now, the Nigerian Petroleum Development Company has reported an explosion at its production facility in oil mining lease 40 involving its partners and Limited, Elcrest Exploration and Production Nigeria Limited,